Health is a state of body and mind. Wellness is a state of being. We want you to have both. This is Channels of Health, the podcast giving you ideas and insights into new and time-tested avenues to health. From mental wellness and innovations in mental health to our daily lives and overall health journeys. Join your hosts, Patty and Damien, both founders of organizations dedicated to healing, as they bring candid conversations and new information to you. Let's start the show. Here are your hosts, Patty and Damien.
Welcome to another exciting episode of Channels of Health. We are, it's early for us, but we're excited to be here. How are you, honey? How are you?
We're so excited to invite Callie into our
Absolutely
place today.
Good morning, good morning.
Good morning.
Callie, let's just get right into the game today. Tell us what you do, how you got into what you do, and what you like about what you do.
Great. Well, I'm thrilled to be here, and I am a genetic counselor. So I was originally going on a pre-med course in college, and I've always loved genetics. I got pretty into psychology. That ended up being my major. And somewhere along the line, I heard about genetic counseling and realized that genetic counselors are able to spend a lot of time with their patients explaining things. And they're able to spend a lot of time on genetics, which I loved. So that's how I chose the career path.
And that's fascinating also because you were already in psychology, which is very important as a counselor. So you were already sort of in the right mix, I guess. Is that right?
I was. And there are psychology prerequisites to even getting into genetic counseling master's programs.
Talk a minute about that. The program, the background.
Well, I didn't even know this was a thing. So let's just start there. As of a week ago, I had never even heard of genetics counseling. So next thing I know, in a week, because Patty is super producer, I'm sitting across from a genetics. So you guys are talking, I'm trying to catch up. What is a genetics counselor?
Sorry, Damien. Yeah.
No, it's all right.
Point.
You know me. But what is it? I don't even understand. You're counseling genetics. I know you're talking to people, but what do you do in an average day?
You're not alone, Damien. I get asked all the time, what is that? What do you do? So back to the graduate school question, the graduate programs are 2-year training programs. They're often masters of science in genetic counseling, a specialized master of science, or in human genetics. And a lot of the courses have to do with molecular genetics, human genetics, genetic diseases, counseling, ethical issues in genetic testing and research. And then there's a large clinical component of genetics counseling school where you're seeing patients with a supervisor over your shoulder, seeing everything you do and giving you feedback. What I do, what generally genetic counselors do are talk to individuals and families about their genetic risk of disease. And that could be in a number of contexts. So a large portion of our genetic counseling workforce is in cancer genetics. That would be talking to people who have an early diagnosis of cancer, maybe in their 20s or 30s, and or a family history of lots of cancer, often at young ages, and they're talking to the family about maybe doing some genetic testing to see if there's a genetic mutation that we can identify if they have that puts them at increased risk for cancer.
So nothing's happened to them at this point. They're just being forward-looking and advocating for themselves?
Sometimes. Sometimes the person sitting in front of us does have cancer. A 32-year-old with breast cancer. You know, why did that happen? Often that happens spontaneously. It's not hereditary, but sometimes it is. So sometimes they do have cancer, sometimes they don't. In other contexts, prenatal is a big area of genetic counseling. So you're talking to a woman or a couple who's expecting a baby, and they might have had some type of screening that indicates a genetic disease, or maybe there's signs on an ultrasound, sonogram, that the baby could have a genetic condition. So a genetic counselor would explain to them what that means, how we may do further investigations to figure more out about what's going on with the baby and if they want to do that or not.
Wow.
And then what my work is now is more in the pediatric realm. I'm doing all inpatient genetic counseling. So I'm working inside a hospital, mostly with newborns who have some type of thing going on. I don't want to say a problem, a medical issue, maybe just a physical difference that could be genetic or could be a sign of a genetic disorder.
Okay. So then you are like a liaison with the parents during this time after the baby's born. So between the doctor and the parents and trying to help understand what's happening. Is that
Yes.
the general? Wow.
Yeah.
Okay.
We do participate in the actual evaluation of the baby, looking at the prenatal history, how the baby's doing, the medical history. We often work with an MD geneticist, a doctor who's trained in genetics, who does a physical exam. And we're the ones who really talk to the parents about what's going on, what type of genetic testing may be appropriate, and getting their consent for that testing, and then often giving those results back once they arrive.
Okay.
I think a real important distinction to be made here is that there's a lot of counseling that is being done prior to suggesting the test itself, so that people are fully informed. There's not just this rush to take blood or get a swab.
Right.
There's a lot of conversation and counseling so that people are prepared to understand the results when they get it.
Yes, and that is what I love, and that is how it would work everywhere in an ideal world. If there are enough genetic counselors, there's this really interesting push and pull between encouraging access to genetic testing versus having that type of model where someone sits down with the person and explains things and gets their consent and then does the testing. And kind of what I mean by that is if we're trying to get genetic testing to more of the population that could benefit from it, there's not enough people like me or who are familiar with genetics to really explain that. So there's a lot of genetic testing going on without the counseling beforehand. And that's just how it is to increase that access.
That's an interesting point. I'm trying to think of how we might be able to help
Yeah,
people.
no, you know how our minds think.
We're thinking the
Yeah,
same thing,
yeah.
weren't we, Damien?
So how did this career come about? Because obviously there was a point where there wasn't genetics counselors. So was it as a result of people just not knowing what to do with the information they were given? Like, what was the problem that was cured by creating this whole path?
The beginning of the profession was in the 1970s, actually.
Oh, wow. Okay.
It's been a very small profession. It's now rapidly growing. I think there are only about 5,600 genetic counselors in this country, but rapidly growing. And most genetic counselors, I believe, started off in pediatrics or prenatal settings. And that's when we could first do a test that showed that the baby had differences in their chromosomes.
Okay.
Like a condition like Down syndrome is caused by a difference in the number of chromosomes. So they could then find that out on a pregnant woman, and there needed to be someone that they could talk to in order to understand what that condition was like and what options were moving forward.
Wow. So all of these years, if there wasn't a genetic counselor, who were they talking to? Was it literally the doctor? It's like, here's what we found. You know, I mean, it just kind of like do with this as you will. And
Yeah, and some doctors are wonderful at, providing that genetic counseling piece, and some doctors aren't as familiar.
Right.
And as the knowledge of genetics has grown and grown and grown, and we have a out, doctors just can't keep up with all of that information. They shouldn't be expected to.
Yeah, I agree. It's just only so much that one person can be responsible
Well,
for.
the whole subject hard for professionals to try to make it accessible to listeners who are not in the medical profession. Can you give us sort of a 101 college basics? Are people that are listening are intelligent? They're
Basic to listeners, and I tell my patients this sometimes. This may be overly basic, but just so is our DNA, our full set of DNA. And DNA is like a long strand of nucleotides or base pairs. Those are abbreviated A, T, C, and G. So we'll just call those the letters of the DNA, or the letters of our genetic code. So inside every cell, we have our strands of DNA. We have 3 billion letters of the DNA in each cell. Now, most of that DNA material we don't think does much for the body. It's historically called junk DNA. We actually are understanding that some parts of that do have a role, so it may not be junk, but the vast majority of those letters of the DNA don't have a known purpose. The portion that does are genes. So Genes are like sections of those strands of DNA. And genes are what give the body instructions to make a protein. They encode a protein.
So when I'm looking at the DNA double helix, the ladder, a section of that would be a gene.
Yes, exactly.
Did not know that.
All right.
All right.
We're off and
We're
running.
learning. Everybody else knew this. I know. I'm the only one.
No, I don't think that's the truth.
No, it's not.
And those double helix strands are all stored in larger structures called chromosomes. So that's where the chromosome part comes in. We all have 23 pairs of chromosomes, 46 total.
See, I've always learned what I call the nesting doll. Like, I want to know what is in that helps me always remember it. Yep. If I hear about it separately, I will never fully understand. So I never connected that. So
let's do a nesting doll.
Let's do it.
Yeah. We have the human body.
Yep.
We have the cell.
Okay.
We have the nucleus. We have chromosomes.
Okay.
Inside the chromosomes are strands of DNA, a double helix. Inside those strands are genes.
Oh my gosh.
We just zoomed in.
Totally nailed it.
Yeah,
Zoomed
zoomed
in.
in. And those genes help create proteins
Yes,
to build everything that we are.
everything. Yeah.
All right, this is a wrap. We're
All right,
good.
guys, well, it's been a good show. Yeah, okay, man. I did not understand that. So when you say there was 3 billion, is that 3 billion of the ATCG or whatever that was?
Yes.
So is it 3 billion different, how do I say it, 3 different versions of those 4?
3 billion,
3 billion
of those letters in some sequence.
So like zeros and ones can be organized in a million different ways for code. It literally is just in a different order.
The vast majority of the sequence of our DNA is the same between 2 humans.
Okay.
Now let's talk about variation
Yeah,
between
yeah.
humans. We're all different, right? So that's due to differences or variants of those letters of the DNA.
Okay.
So where most people have a T, I might have an A. And that might not have any medical or physical outcome or consequence. That might just be a change in me that's unique to me or unique to my family or my population, my ancestors.
Right, yeah.
Other variations might have to do with certain traits, how tall you are, what your eyes look like, color of eyes, color of hair.
Right, yeah.
Other variations have to do more with traits that are wellness or health related, like if you can taste cilantro or how your body metabolizes caffeine. And then there are the variants that actually cause disease. And historically, we call those mutations or pathogenic variants. Pathogenic means disease-causing variants.
Got it. Man, this is good. I'm not trying to be funny. I did not understand any of this.
Well, hey,
Well, I think a lot of people do not, and unless you need a genetics counselor, or you're just kind of geeky or want to study it for fun,
Or us. Yeah.
or us, yeah. But no, seriously, I mean, we talk a lot about, like, I'm supporting UNC in their eating disorder genetics initiative, and I could not really talk about it very intelligently, and so
it's complicated.
we needed Callie
And
to come and explain it.
educated people have an idea of genes and DNA, and they understand that's your inherited material. But when you get to genetic testing, genetic studies, it's so complicated that I feel it's really important to understand how genes and DNA works. You understand the testing that you're going through.
So talk a bit about the testing for people who might be interested. What would you want to test for? What would people, aside from somebody who you are already counseling, who you've just discussed, oncology, prenatal, some of those subjects, for the average individual who wants to learn about their ancestry or their heredity or something like that, talk about what they might want to get tested for, how that would work, good ideas and not so good ideas about where to go.
Most of your listeners are adults.
Yes.
So I'll kind of speak more to the adults.
Yeah.
If someone's interested in knowing more about their genetic ancestry, there are consumer DNA companies that offer that testing service. You spit in a tube, you send it in.
Yep.
They tell you if you're French or have some African or Jewish or whatever.
Right.
That's the best way really to get ancestry information. Coming to someone like me, we don't really offer that testing. It's not medical. So that's what I would recommend for those people. Now, I would be careful because a lot of those companies are not subject to the same type of privacy laws as medical companies or medical institutions. And they can use that data. You click through the boxes, I agree, I agree, I agree, I agree. Well, you might be agreeing to them sharing your genetic data for good purposes, maybe, hopefully, but still sharing your genetic data with other parties.
That's really scary.
We were talking about that the other day with
That's
one
really
of our
scary.
other guests, and I didn't think about that.
Me either.
And so that's why I did want Callie to be comfortable talking about it, but to share that information that.
And you're such a mature adult, because I'm over here thinking of all the sci-fi movies that I've watched. I'm like, oh God, this is how it happens. Like, we all spit in a tube, and then we sold our genetic information, and then next thing you know, I've got twins walking around.
Callie brought it up the other day that it is unique to you. So they could identify Damian Skinner if they had a
That's
sample of your
fascinating.
DNA.
They can strip your name, strip your address, strip your medical information that you've provided them, but your DNA sequence is unique to you.
That is your signature. I mean, there is nothing else more unique to you, right?
Right.
That's crazy.
Bum, bum, bum.
All right. Now my mind's going in a totally different direction.
So that's the ancestry part. So if there was an adult that was interested in more the question of what diseases am I going to get? What am I at risk for? My first thing that I would tell someone is, do you have a significant family history of some disease that multiple people have had? Maybe that has an onset earlier than normal. And if you do, I would definitely recommend genetic testing. If you have a lot of cancer in your family, go see a cancer genetic counselor. If you have a lot of individuals with Alzheimer's in your family, primarily if they've been diagnosed before the age of 60, go see a genetic counselor who can test about that.
Callie, do you need a prescription to see a genetic counselor if you have some of those concerns?
Usually not. Everywhere that I've worked, we accept self-referrals.
Okay.
So sometimes someone's insurance might require that they have a referral from a physician who said this person needs to see a genetic counselor. But a lot of the groups that I know of do not require that themselves.
So that's very helpful.
Yeah, and kind of surprising. I'm surprised that you can just so many things with my parents, and we're always talking about people that we know that are going through ongoing issues. I'm just surprised that that's so easy. You know what I'm saying? Like, it took me 2 years to get my dad in for some test, but that's good.
Well, and there are still a limited number of genetic counselors.
Yeah.
We're lucky to be in a big city. There's a good amount of genetic counselors here. Yeah. But there are more companies popping up that are providing telemedicine genetic counseling because there are not enough genetic counselors. If you go to a smaller city or a rural place, you're not going to be able to access. So there's more telemedicine options.
But 5,600 in the whole of our country, that's pretty small.
Yes.
I would have expected that there would have been more than that, but then to the point, we didn't even really know genetics counselors existed until recently.
I mean, but it also is good to know for people that are looking to get in industries that there's a major demand, because what I love about this is such an interesting hybrid of hard science and people skills.
That's what I love about it,
I
too.
can tell it's your personality. Like, you're a really good match between intelligence and people skills, you know? That's a unique fit. It really is.
So to that point, let's talk about the psychology around the counseling and what you have to share with people and how they handle it, without obviously disclosing anything you're not supposed to. But in general terms, what do you do? Help us put our listeners in the room with you and some of your patients.
Genetic testing can be scary because you might find out that there's something really going on that puts you or your family members at risk of a serious disease, whether that's cancer or a heart problem that can cause early sudden death, or in my work now, a lot of people don't want to know that their baby might have a genetic condition, a genetic syndrome. Many of those genetic conditions have poor outcomes. Many of them don't. So it can be scary to know that something is genetic. There's also if a family comes in and we're doing testing to see who has the gene or the gene mutation that's putting them at risk for disease, and one sibling has it and one doesn't, that one who doesn't often feels guilt, survivor guilt.
Yeah.
So that's an issue too.
Gosh, how many times does that subject come up, Damien?
Survivor guilt and shame are the two most consistent subjects that come up in every one of our podcasts.
Really?
Regardless of the subject, regardless of the guest, it is
Wow.
that, and I kind of roll that into shame anyway. Like, that is a
But
shame bucket.
I did not target for this. I did not angle for this.
No,
I didn't see
we're
it.
discovering it.
I didn't see it coming, but seriously.
We hear it every time.
A bulk of our
Yeah.
podcasts deal with a parent finds out that their kid is addicted to something. What did I do wrong?
Yeah.
Right.
A parent finds out the kid has eating disorder.
Yeah.
What did I do? What did I not do?
Yeah.
A parent finds out their baby has a genetic condition that just happened spontaneously in the baby, yet the parents continue to think, what did I do during the pregnancy? What did I do wrong?
Yes.
Yeah. So that happens a lot in pediatrics, where there's no family history of a condition. Parents are not necessarily expecting to need genetic testing. But if there's a child who has multiple issues going on that don't seem to be related to one another, they could have an underlying genetic reason, and that's when we would do genetic testing.
Can you give us an example of some of the underlying, not the underlying issues, but what is being presented? What kind of issues might a baby present?
Yeah.
Where the doctor would say, we need to get Callie in here. We need Callie to be discussing this with the parents to prepare them for what they might need to get some testing on. What kind of medical conditions might present?
So maybe there's a baby born with a hole in their heart or a difference in the way the heart was formed, which is actually pretty common. But maybe that baby also has a difference in the way their kidney is shaped or is functioning. Maybe that baby has club feet, or I saw a patient recently with an extra finger. Maybe that baby has some physical abnormalities plus things going on the inside of the body. Once you kind of start counting up the signs or symptoms that a baby has, you start wondering, is this all coincidental? It really doesn't seem like it. This is kind of too much to just be a coincidence.
Okay.
And you start thinking about genetic testing.
That's helpful.
Genetic conditions, and one of the things that is fascinating from a medical and genetic standpoint and difficult for families is that a change in one gene, mutation in one gene, can cause a bunch of different issues and
like a
bunch
domino
of different
effect, right?
body systems. Yeah.
So when you're working every day, and I'll use the term kind of on a frontline situation with people, I don't think that's a stretch. And how long have you been doing this? That's probably a good question.
About 6.5 years.
Okay. I mean, you've sat with a good amount of people in 6.5 years, and you've seen a lot of babies born. You've been through this process. When you're working, what you do is to help people accept what has happened, right? Now, there's other people working in genetics that are on the other side that are trying to figure out how to prevent these things from happening. I always find this interesting from my documentary background. Like, you're in the trenches all day helping people accept it. Where does your mind go on the other side of it? Like, do you get to see progress over time on diseases? Like, do you think you'll be able to see, like, man, I used to have to talk to parents about Down syndrome all the time, but it seems like over the last 20 years, do you think you'll see that kind of start dropping off, some of them? Does that question make sense?
Yeah.
I don't know if it does or not.
It's very exciting.
Okay.
Let me give you an example. There's a condition called spinal muscular atrophy, SMA.
Okay.
And the carrier frequency in the Caucasian population, I'm forgetting the numbers, I should know that, is high. It's not uncommon to be a carrier of this condition, and you can have a child if your partner's a carrier. This is a devastating condition where kids don't develop normally. They often die before the age of 5, if not much earlier. There is a treatment for this disease now that's extremely exciting. So that's just one example of what I hope will be many, where we're seeing treatment, gene therapies for these conditions.
Yeah.
And there are just thousands of conditions, and each particular one is going to need a specific treatment.
Right.
So that's going to take a long time to get to. The more common the condition is, the more
Sure.
research monies are going into it.
Yeah.
So the more common conditions will be, hopefully, we'll find treatments
Yeah.
first.
I would just think with you being there every day, helping people accept and know how to look forward. And that's another question of like helping people with what they do next, you know, for the rest of their lives in some of these conditions. You also get to see some of the shifts. And I'm curious, is there a feedback loop in the industry, for lack of a better term? Like, are geneticists getting information from what you're doing? Are you getting information? Is there any feedback, or are these like two separate fronts of the battle?
Unfortunately, I feel like it's more two separate fronts.
Okay.
In my experience, I think there's some of that feedback, but it feels pretty separate to me.
Okay. Yeah. Is there an overall governing body for what you do? Like, is there an organization that everyone belongs to, or?
There's the National Society of Genetic Counselors that
Okay.
a lot of people belong to. There's the American College of Medical Genetics, which a lot of MD geneticists and researchers and genetic counselors
Okay.
belong to. So that's a great place, a great conference where everyone comes together and talks about these things.
Yeah.
This is a wonderful segue. Thank you, Damon.
That's what I do.
You didn't even know.
I had no idea.
So I would like to ask you to talk about ethics. Ethics in research, ethics in the results, and how they are transmitted to people. So whichever one you want to start with, but I would like for you to do a little bit of conversation around ethics.
Sure. Let's start with ethics in genetic testing, not research, just genetic testing.
Okay.
So if you're doing a broad genetic test, you can find a lot of stuff. And if someone has not told you the type of thing that you can find, that can be a difficult situation. So if you're doing a test of multiple genes, you could find that there's a mutation in a gene that you weren't really looking for or expecting. You could find that someone, you're testing the family for a problem with the child, but you find that the family has one of those cancer predisposition genes or cardiac predisposition genes. That could be a surprise to the family, and they might not have wanted to know that. You can find out things like parents are related to each other, which happens. You can find out things like the father is not the father, and he doesn't know he's not the father. So there are a bunch of...
Dad is not bio-dad.
That's
Dad is not bio-dad, and Dad
Yeah.
thinks he's bio-dad.
Zoinks.
So that's kind of where I was saying this was a great segue.
I hadn't thought about any of that. Wow.
Because I would suspect that these organizations, these national groups that you belong to, would have courses in how you handle the disclosure or the non-disclosure, or what do we do next. And
It is such a gray area, Patty, that it's case by case. I think there are some general ideas about how to handle those types of situations, but you're really feeling out each case and what is best to do in that case. I've had 2 times where we've done a test showing that the father's DNA that he submitted to be part of the testing, which is great, does not match the child's. And in both of those cases, we decided to somehow find the mom individually, notify her of this, and kind of leave it up to her. But we did not explicitly say anything to the father.
that requires a lot of maturity and a lot of wisdom on the part of the counselor. Do you do that in conjunction with other people so that you get collective wisdom about how to handle this?
Yeah.
Oh, yes. You talk to colleagues, you talk to your superiors, you often talk to an ethics board at a hospital. So people are aware, and everyone's kind of advised each other of how to handle this, and you document.
I was just thinking the exact same thing. You have to be very careful documenting what you said, what you didn't say, what you left out.
But I'm sure at the end of the day, it defaults to a priority of what the goal here is, right?
Yes.
Like, that's the hard line, is we need to let them know that they have this situation. Maybe it's not up to us to let them know that that's not the baby daddy or whatever.
Yeah,
know?
are you going to ruin this family? Are you, in the midst of all of this genetic investigation, are you going to separate this family
Yeah.
or cause a
Yeah.
disruption.
Because if you were a marriage therapist and you were getting these DNA tests, that's a very different thing. That's what the DNA test was about.
Yeah.
But in your case, it seems like it would be weird to go, hey, while we were doing what we're supposed to be doing, we also discovered that you're, married to your cousin. That might seem like a weird. Now, that's an ethical question. And I'm not going to make any jokes because that can be a very dangerous situation. So in that case, maybe you ethically do need to communicate. Like, you guys know how close you are on the tree.
Every time we do a test that has the potential to show that, I tell the parents, even if I'm, highly confident that they're not related.
Right.
I say, this test does show if someone is closely related by blood. And I've gotten some surprises. There are also cultures where it is custom to marry within the family.
Yeah.
So we see
For
that
sure.
a lot as
Right.
well.
So when you tell them that ahead of time, do you ask them at that point, if I find anything out, do you want to know?
I ask them if they're related to each other by blood. I tell them this test can show that. I don't expect it to, but it can. And if that comes back, I usually do say that this shows you have some common ancestors. Sometimes I couch it as ancestors.
I was
even
gonna
though
say,
it's
that's a very
closer
different-
than ancestors.
Well
Yeah.
done. Well done. I
Yeah.
caught it. I'm like, ancestors. Well,
Yeah.
Cautious vocabulary.
That was well done.
The wording that we use is very important.
yeah. And I don't want to spend a lot of time on this, but my whole life and everybody else has heard that if you are married to people close in your family, you get these genetic mutations and problems. Can you kind of explain how that happens? I've never
Absolutely.
actually understood why that happens.
Yes. So let's think about a disease that you can be a carrier of. Let's say cystic fibrosis. A lot of people are a carrier of cystic fibrosis. You don't have the condition, but if you have a partner who is also a carrier, your child could have the condition. That's because we have 2 copies of every gene, and if you have a mutation on just one copy, you don't have the condition, but if you have a mutation in both copies of the gene, you do have the condition. That's called a recessive condition.
Okay.
Other conditions are inherited differently, but that's a recessive condition. We're all carriers of some rare condition.
Sure.
If you're marrying your cousin or having children with your cousin, the chance that you two are carriers of the same rare condition is higher. And it's actually a really interesting area for genetics because that has allowed genetics to discover some extremely rare disorders that we wouldn't have seen otherwise. I remember a family where the 2 children did not have pain. They were chewing, this is, disclaimer, a little grotesque for your listeners. They were chewing their fingers and toes to the point, that they had to amputate.
Dear God.
Yeah, they were jumping off the couch, breaking
You
bones.
have no pain receptors? or-
No pain. Somehow they didn't feel that pain. Parents were related. I forget what the gene was that we found, but that is an extremely rare condition.
Thankfully.
That those 2 parents just happened to be carriers though because they were related. Does that answer your question?
How do you...
I'm trying to be.
Okay, Damien.
I'm trying to control myself. I have so many questions about genes and
now
genetics.
I should say that there are a lot of families who do marry a cousin, a second or third cousin, and their children are perfectly fine and healthy. The risk might not be as high as people perceive it to be.
Okay.
That's good. Thank you. We don't want to scare people either.
Yeah.
It's good to be
Sure.
informed, but ethics in research. That's your next topic.
All right.
We're just throwing them at you. We're like little kids.
Well, I already warned her. I said these were the 2, right?
Yeah, you did.
And she's prepared because we've already kind of talked a little bit about the subject.
And
so.
gosh, there are experts in each of these areas that could just talk even so
I'm
much
saving
more
my
than I.
absolute ridiculous question for dead last. I have a ridiculous question, so I'm excited.
Are you
gosh,
really sure
can't
you
wait.
know what dead last is anymore?
No. I always say that, and then there's like 7 more questions.
Last
so.
time he said dead last, we went for 20 minutes more, I think.
Yeah, I was winding it down. So
Okay.
Fair enough.
ethics and research.
So what pops into my head right now is justice in research in different populations. So this country has had a lot of discussion around race and ethnicity in the past couple years, and that's a really big topic even before those discussions in genetics. A lot of genetics research is focused in white, Caucasian, people of European background. So the findings of those research are not applicable to other populations, or not as applicable. So that's one area. Another area that I think of is a lot of genomic research is looking at your full genome. That's your whole sequence of your DNA. So they get your sample, your blood, or your cheek swab, whatever it is, and they sequence your DNA, and they're looking for, like you are related to the genes related to eating disorders, for example.
Right.
Well, they also have access to your other genes. If they happen to see that you have a gene that puts you at a high risk of having sudden cardiac arrest, at an early age, do they tell that to you? Was that part of their consent form? Are they going to agree to look for and give you that information? Are they going to not look at that information? So there's so much information that you can get out of your genes that in a research context, the researchers might be able to see or find, but might not be able to disclose to a family.
Wow.
Pretty interesting stuff.
Well, and the ethics aspect, I'm trying to figure out how to ask a question because, and it's a serious question. There's a lot of platforms where specifically African Americans are talking very openly about not wanting to submit their genetics.
Yeah.
Are you aware of this issue? Okay. So I find this fascinating on a social level that for whatever reasons, the distrust and everything is to a point to where there's a resistance to even working within things like genetics, right? From your perspective, anyone that's listening that might share this viewpoint, whether they're white, black, whatever, I don't care. What can you say around these concepts? Like, you're there every day using this information to help people. Can you help people feel a little more comfortable about sharing their genetic information? And you've already talked about being safe and being careful. I think if you go online and you send your spit somewhere, that might be a little concerning. But if you're walking into a place, which we're not naming on purpose, but you work in a very large, medical facility, what can you tell people that feel paranoid about sharing their actual genetic information?
I first tell them that their concerns are valid
All right,
and that
right
I'm
on.
glad they're asking about it.
Good.
I love when people ask about that.
Good.
There are some people who are just never going to give their DNA, and that's fine.
Sure.
I can't convince them otherwise. Talking a lot about where that data is going, where it's stored, how that institution or company handles that. Do they share it? In what cases would they? Is important. Mm-hmm. I've made requests to genetic testing companies to have someone's DNA data deleted. Some people prefer that. They want to get the test, but then they want everything
I didn't know you could do that.
Cleared.
Okay.
You can, in most cases. So having a conversation with that person all about privacy and security and being honest about the limitations. No one is completely immune to hacks.
Sure.
So, I can never tell someone that your DNA data is 100% secure.
Right. I love that was your answer, because a lot of people will be like, oh, it's secure and we got double blah, blah. But exactly, and I feel like a lot of times people will lower their defenses once people are just honest about, you might be exposed.
Totally.
I mean,
Yeah.
AI could kick in here at some point and be like, oh, we got everyone's genome, and
They expect you to convince them, and then
Right. Right. Yeah. So I love your honesty about that. And it also ties in, and I know I'm going into another sensitive subject. I'm doing this on purpose. Can you explain for me, I'm sure everybody else listening completely understands this, what is the difference between DNA and RNA? Can you explain that for me?
Yes. So DNA is what is inside the nucleus of the cell.
Okay.
That's that double helix. Earlier I said that our genes, those sections of DNA, encode proteins or make instructions for proteins, but I skipped a few steps. And RNA is in between those two steps.
Oh, okay.
So RNA is a DNA-like molecule that's not double-stranded that goes outside of the nucleus to then actually encode the protein.
Wow. Okay. So is it possible for can you cause your DNA and your RNA to mutate after you are born? I know this is a crazy question, but can you take shots? Can you take vaccines? Can you be exposed to gamma rays? Can these things actually alter your DNA and RNA?
Yeah, so sunlight damages DNA.
Okay.
That can cause cancer, maybe other things that I don't know about. Your DNA naturally gets damaged, makes errors, and stays that way. As far as shots or you actively doing something to change, I can't really think of anything.
Okay.
I don't want to get into COVID mRNA vaccines because I just feel like I'm not expert enough to chat about that.
Right. And my question in going into any of that is you hear all these things on all your social platforms and you hear these terms and you're like, oh yeah, RNA, that's part of the DNA. But I don't think most of us actually know what these terms really are.
Yeah.
And so just getting clear on what they are. I didn't know the RNA comes out separate of the DNA. I didn't know all that. That's really cool.
We are going to be listening to this recording over and over again.
Yeah.
Just so that we can get it
Very educational.
and understand it.
Before I ask my ridiculous question, did you have any sincere, real questions? Before mine?
Well, now you make me curious.
I know, me too.
But mine's going to sound very boring since you've
I
already
bet it's awesome.
given the
I bet it's
warning that
awesome.
yours is wonderful. Explain to the listeners the difference between ethnicity, ancestry, and the other subjects that
that's
sometimes
awesome.
and race that
Great
can be
question.
confusing.
Yeah. So this is something I've tried to learn more about, and I am not an expert on. Those terms, race, ethnicity, and ancestry, are fluid. They don't have a specific definition. So my best understanding from experts that I've kind of listened to is that race often has to do with certain physical characteristics, color of your skin, shape of certain features of your face, and it's often a socio-political mechanism for classifying people, and that's socially charged. We often, sometimes I avoid the term race because it invokes, racism and those things. Ethnicity, I think of as more cultural. What you eat, your religion, I think of that as someone defining themselves in a more cultural way. And of course that has overlap with physical characteristics and where you're from too. Your ancestry is more your direct lineage, your direct genetic lineage. So that's where genetics plays in the most. What variants in your DNA can we see that we know come from an African population, an Ashkenazi Jewish population, an Asian population. Right. So ancestry is more your genetic lineage.
Beautifully said.
Yeah, really well said.
Thank you. That was you knocked it out of the park.
Yeah.
Thanks, Callie.
You're
that was
too
really
kind.
good.
It's awesome.
Okay, on to the ridiculous. Here we
Yeah.
go.
I'm
Drum
nervous
roll.
now.
All right. Now, I have asked this question, and she answered it, but she told me I couldn't ever state, but you know who I'm talking about. I've asked someone who works in the genetic field this question. When people are born with strange things, whether it's physical, mental, or whatever, and we haven't really, we don't have time to talk about the mental aspects, like mental illness and genetics and all that. It's another huge, fascinating.
Totally. Yeah.
But one of the things that I've always wondered, and other people have, is, is there a chance that any of these things at this stage are just humans evolving, right? I want to be careful. I'm not saying an offensive thing. For example, an easy one is some people talk about ADD or ADHD actually being an evolutionary trait, and that, a couple generations from now, everyone is going to have that, and it's the new norm. Do you ever see anything in your space, and what's your personal view on this? Because this is everything. I'm a filmmaker. You're talking about X-Men. You're talking about mutants. You're talking about, and what people don't realize is all those stories were written from the concept that the things that are wrong with us are us actually evolving, and there's going to be a day where that's what we really are. Crazy question, I know, but what are your thoughts? Because I've heard the answer from some other people, and it kind of blew my mind.
I want to hear the answer from the other people.
Yeah, I'll tell you afterwards.
Yeah.
That's great, Callie.
So,
What did they say first, and then I'll tell you?
Yeah. Can I talk to them?
And
Yeah.
they're probably more expert on that. I'm not an evolutionary biologist
No,
or geneticist.
I understand.
My initial thought is that what I see is rare and is not part of evolution.
Okay.
It's something that...
It's true disease.
Yeah.
Okay.
Yeah. Now, I've done, and this is just personal stuff, I've done some reading that babies are being born with smaller mandibles, lower jaws, for example, and more kids are having sleep apnea. It kind of,
Pushing
if your
back
jaw
the-
is smaller, your airway can be a little more small or blocked, and more kids are having trouble with that. Is that an evolutionary thing? Why are more kids being born with that? Does that have to do with nutrition
Right.
and how we eat, which is a little different than evolution? So my basic answer is no. What I see is not.
Which would make
evolution.
sense considering what you do all day, every day. You're not seeing anything that is evolution. It's the disease that we're trying to stop.
Yeah.
Yeah, it's fascinating.
Yeah.
So
Interesting question.
I know.
Very, very cool stuff. To
and I
think
saved
about.
it for the end.
Yeah.
The person that I talked to just a few weeks ago about this, after they stopped laughing after I asked my question, she said from her standpoint that absolutely, almost on a weekly basis, they see things that they just kind of look at each other and are like, well, that's evolution. Like we literally can see evolution in a petri dish. That's my word, my term. But she's like, over time, as we're doing research, we can see things that probably 100 to 200 years now is going to be evolutionarily widespread.
Wow.
And that got my mind,
Oh my gosh.
I haven't slept since then, man. I'm just writing comic books and yeah. So
That is fascinating.
now, I think a good question for our listeners in ending is anybody that does have a lot of family issues, a lot of things that they know, how do they go? Like they're listening right now. They're like, oh my God, my whole family's had heart failure or whatever. Where do they go to find
Google.
what you do? I love it. Google.
Go to Google and type in Dallas Genetic Counselor Cancer. Dallas Genetic Counselor, whatever it is in your
Okay.
family.
Add your thing on the end.
Yeah.
Okay.
Hopefully one of the medical institutions in your city comes up and there's a group of genetic counselors that you can go see in person.
Okay.
That's the best.
Okay.
You could also Google telemedicine genetic counseling, and you can find some companies. Genome Medical is an example of a great company that's doing telemedicine genetic counseling services.
Awesome.
So I would just search. I would ask doctors if they know of referrals. Sometimes they don't. I would ask around and use Google.
Awesome. Always our friend Google.
Good advice. Yeah.
You got any other questions?
No, I'm good. I thank you, Callie. I'm really, truly, genuinely appreciative because I know you shed a lot of light.
This was so fun. I got to speak about what I love doing and share about genetics, which I hope more people understand. So thank you so much
After
for having
today,
me.
I'm sure that there are a lot
Yep.
more people that understand it.
Yep.
And if we have questions as genetics evolves,
Oh, look at that. Marketer.
we can invite you back because we would love to have you come back and help us understand more of your subject.
Thank you so much. Appreciate it.
Well, listeners, we thank you for being with us today. Always want to remind you to go to channelsofhealth.com to listen to the rest of our episodes, and we will see you in the next podcast.
Thank you for listening to Channels of Health. We're so glad you've joined us today.